Hello and welcome to Local Doctors on Call. I'm Alex Redmond. We scratch, we rub, we self-medicate, and most of all, we suffer. If you're one of the millions of Americans suffering from these symptoms, then you know exactly what I'm talking about. Dry eyes. Other symptoms may include burning and a feeling that something is in your eye. And left untreated, advanced dry eyes may cause permanent damage to the front surface of the eye and impair your vision. But what causes dry eyes and why does it affect so many? Although considered to be age and gender related, there are several other causes of dry eyes, including the environment, medication, and medical conditions. In the past, we relied on over-the-counter eye drops, and although they initially offered relief, over time they either lost their effect or had adverse effects. Here to offer you some hope and relief and answer your many questions about dry eyes is Dr. Brian Foster, a fellowship-trained cornea specialist who performs corneal transplants, LASIK, and cataract surgery at the Eye Associates West Bradenton office. Welcome to Local Doctors on Call, Dr. Foster.
Thank you. It's good to be here.
It's great to have you. And you're an expert in many things, and we will talk a little bit about the advanced procedure with corneal transplants later in the show.
Sure.
But for now, let's talk about what exactly dry eyes are.
Definitely. It is a great topic because it's such a common condition. And as you already mentioned, it affects millions of Americans. There's a wide spectrum of severity of the condition, ranging from very mild to very severe, to even sight and eye threatening. Basically, the first thing I like to tell patients is there is hope. It is typically a chronic condition, meaning there's no cure, but there are just a wide variety of treatments that are available and tend to provide significant relief for this condition. I guess the first thing I'll say is that it is what I call a multifactorial disease, in that there's not just one cause for the condition. And to break it down, the first thing that's important to know is essentially it's a disorder of the tear film. The tear film is a thin layer of fluid, oil, and mucus that covers the surface of the eye. And it's something that is designed to get replenished with every blink and spread evenly across the ocular surface, providing comfort and clear vision. And if any of these three different components of the tear film are disturbed, if any of these components are out of balance, it tends to cause dryness, irritation, blurred vision, eye fatigue, particularly in the evening if you're trying to read or something like that, or especially on the computer screen.
All right. What are some of the other causes of dry eye syndrome?
Definitely. One of the very common conditions is a syndrome called Sjogren's syndrome, and it's also associated with dry mouth and other diseases such as thyroid conditions, diabetes, rheumatologic diseases like rheumatoid arthritis are also strongly associated with dry eyes.
All right, and as we mentioned during the introduction, millions of Americans do suffer from dry eyes. So we'd like to let our audience know that we have opened up the phone lines for you to call in with your questions about dry eyes, and our phone number is 361-4675. Again, the number is 361-4675. All right, so we talked a little bit about what dry eye syndrome is and a little bit about what causes it. Let's discuss some of the treatments and cures.
Definitely. In mild cases, often a simple over-the-counter artificial tear is helpful, but often these do not solve the problem, and I'm sure many people listening have tried lubricating drops and just found little to no relief. If that's the case, I do recommend being evaluated, because there are other things like lid disorders that can contribute. Problems with inflammation of the eyelids can contribute, and even systemic medications, very commonly antihistamines, can contribute to this. And there's a wide variety of medicines that need to be looked at if you're continuing to suffer with dry eyes, and just lubricating drops aren't doing the trick.
And people with allergies, do they often get dry eyes as well?
They often go hand in hand. You know, any allergen can be an irritant to the surface of the eye and cause itching and tearing and redness, and dry eye often is made worse as well by that.
All right, we have our first phone call. Ruth, welcome to Local Doctors on Call. Ruth, what is your question for Dr. Foster of the Eye Associates? Go ahead.
I get a crusting in the eye in the morning, but it's not a typical crusting. It takes over, and when I try to remove it, I actually get bleeding from the eye area, and it doesn't go away. You know, I mean, water makes it hurt.
Sure.
Nothing seems to help moisturize the area.
Okay. Well, that's a very good question. I would recommend an evaluation in something like that, where you have persistent and kind of repetitive bleeding episodes. The vessels on the surface of the eye are very fragile, Ruth, and often if you have dryness and lid inflammation, that can it can be a vicious cycle. Where it's irritated, you're trying to get the crusting out, and you're causing more damage by just mechanical manipulation. So probably an evaluation would be in order, and you may need an anti-inflammatory drop and some good lid hygiene as well is what I'd suggest.
All right, thank you for your call, Ruth. And we can let our audience out there know that if they'd like to reach you at the West Bradenton office of the Eye Associates, they may call 792-2020. Again, that number is 941-792-2020. Yeah, that was an interesting call, but she obviously needs to go in for an evaluation. Yeah. With dry eyes, can it come and go? Can you have dry eyes and then it goes away for a while and comes back?
Yeah, it sure can, and it kind of leads me to the next point I wanted to make, is that environmental factors are really key. As a society these days, we're spending a lot of time looking at smartphone screens and looking at the computer, and the studies have shown that an average person blinking can decrease even up to half as much, from 8,000 blinks a day down to 4,000 blinks a day, with significant computer use. And typically, it's not practical to recommend just cutting out all screen time. It's just not possible. But treatment is often in order, just to prevent symptoms, and just to basically get on with your life in a comfortable manner, with the screen use.
Now, if you have dry eyes and you don't get treatment for it, will this cause other problems down the road, or?
It's possible. Like I said, it is a spectrum. I've seen plenty of cases where the eye is so dry and so irritated that it causes corneal scarring, to the point where even a corneal transplant may be in order. These are very severe cases, but it's something that if left completely unchecked can cause significant damage.
All right, again, we'd like to remind our audience out there that you may call us at 361-4675, 361-4675 with your questions for Dr. Foster from the Eye Associates. Now, if somebody does work on a computer or in front of a screen all day, would you suggest some type of protective glasses or something that can help them?
Yeah, some people like glasses. One thing that I found most helpful is just a little behavior modification, where some people even set a timer where an hour goes by. Go ahead and take a break, a 2-minute break. Just look out the window, put a lubricating drop in. Something easy like that can can make a significant difference. So it's easy for the time to get away from us when we're looking at these screens all day long.
All right. When we come back from our break, we will be joined by Dr. Foster from the Eye Associates West Bradenton office, and he'll be answering more of your questions about dry eyes, and then we may touch on LASIK, cataract surgery, and also he performs advanced corneal transplants. So we'll be right back. Stay with us. Welcome back to Local Doctors on Call. I'm Alex Redmond, and our guest today is Dr. Foster of the Eye Associates West Bradenton office, and we've been talking about dry eyes. We're going to break away from that for a second, and we're going to touch on LASIK, because you also perform LASIK, cataract surgery, and an advanced procedure with corneal transplants.
Sure.
So what's happening with LASIK surgery now?
Yeah, there's LASIK is a fantastic procedure, and I believe in it so much that I actually had it done myself, because I was a long time contact lens wearer and basically abuser, as was what I call it. I definitely abused my contact lenses, and was able to have the procedure done, and I'm so much happier now that I don't have to do that. But LASIK I call it a medical miracle, taking away someone's glasses and really giving them independence from spectacles is just an amazing thing. It's fun to perform. Patients love it, and it's just an all-around great technology.
And you basically see the benefits right after the surgery. I mean, it's pretty close, isn't it?
That's correct, yeah. Yeah, a little blur for the first few hours after is normal, but there's definitely a wow factor that's really exciting. And basically, we have a clock in the LASIK suite, and many of my nearsighted patients, when they sit up after the procedure for the first time, can read the clock, and it's just a very much a wow moment. So it's fun.
All right, we've gone ahead and opened those phone lines up again for you, so you may call us at 361-4675. Again, that number is 361-4675 with your questions about dry eyes, LASIK, cataract surgery, or cornea transplants and cornea health. Yep. So with the corneal procedures, now you went and you furthered your education to learn about this new innovative procedure that you're performing right now. You're one of the few people in our area that does that.
Yeah.
Would you like to talk a little bit about that?
I sure would. So the corneal specialty has had a significant renaissance in the past few years, in that we've moved away from the old style full thickness corneal transplants to really getting to the root of the problem and just replacing the diseased portion of the cornea. The cornea itself is basically a clear protective lens on the surface of the eye, and it has several layers. And one of my specialties is what's called DSEC surgery. And what we do is in diseases that just affect the inner layer, we can remove that and just replace that tissue alone and leave the rest of the cornea intact. Advantages are much quicker recovery. Vision comes back on the matter of a few weeks versus a few months with the old style transplants. And it's a joy to be a part of that.
All right, we have another caller on the line. We have Ann. Ann, welcome to Local Doctors on Call. What is your question for Dr. Brian Foster of the Eye Associates?
Well, I've been told that I have significant dry eye syndrome, and that evidently there are 3 systems that can moisten the eye. I've been evaluated, and they said all 3 had shut down. And I'm coping pretty well with hot compresses at night and, prescription drops in the night and in the morning. I developed allergies to some of the eye drops. But friends of mine have said that they had plugs in their eyes. What do you think about plugs versus hot compresses as therapy?
And that's a fantastic question. I actually, in severe cases, often I'll use all of the above. Because there are several contributing factors to dryness. There's the eyelid component, there's the tear drain component, and there's the actual tear gland production component. Often in significant cases, which it sounds like you're at least moderate, if not severe, often you need to treat the lid margin with the compresses, and there are even some medicines now that are very good at treating that. Another prescription medicine is very good at stimulating your own tear production. And finally, I think the plugs are a good idea. I use a lot of plugs. It's something that's really easy to do. You don't really have to think about it, and they just stay in and help keep more of your own tears on the surface of the eye.
All right.
Okay.
Thank you for your call. Our next caller is Caroline. Caroline, welcome to Local Doctors on Call. You may go ahead with your question.
Thank you. My question pertains to the winter months when we have to use our heat. Hopefully not too much this year, but My eyes get really dry when I have to use the heat inside,
Mm-hmm.
and I wonder what can be done about